Hello everybody, this is DMA FMGE hacks and we are covering the subject anesthesia today. And speaking of anesthesia, we have the compared to the comparatively we consider the previous year question paper. We found like the anesthesia, the 40% of questions from the anesthesia covers the systemic, while 15 to 16% will contribute for the regional, while the miscellaneous topic will be covering 43%. So speaking about that, you have to remember the high yield area is always the systemic anesthesia. So we divide the anesthesia into four broad categories, namely basic principles of anesthesia, anesthesia techniques, perioperative care, and anesthesia in special situations. So what are the basic principles of anesthesia, people? So one is your anesthesia equipment, called the circuit available, the components and their uses. And then you have the anesthetic agents, pharmacology, and the mechanism of action of your anesthesia or anesthetics. And then you have to monitor the depth of anesthesia, vital signs, and fluid balance. This covers the basic principles of anesthesia. And then you have this anesthesia technique. Speaking of the anesthesia technique, you have the general anesthesia, regional anesthesia, and sedation. So general anesthesia, what are the indications, what type of technique we are having, and what are the complications. Similarly, you have to know for regional anesthesia too, what are the indications, what are the techniques, and what are the complications. And sedation too, indications, technique, and complications are the areas where you expect to see the anesthesia techniques. And then you have this perioperative care where you will be taking care of the intubation, extubation, and ventilation. So this contributes for the like airway management is very important component in terms of your anesthesia. So intubation, extubation, and ventilation you have to remember. And then fluid and electrolyte management, indication, types and complications, and pain management, perioperative analgesia, and pain management strategies you have to remember. You have to remember the pain management strategies and perioperative analgesia. Then you have anesthesia in special situations where pediatric anesthesia, which may have a difference in a physiology, pharmacology, and equipment. Geriatric one, again, you have the difference in a physio, pharma, and equipment. And obstetrical anesthesia, you have a management of your labor and delivery anesthesia you have to practice. So speaking about anesthesia is like like a basic principles of anesthesia with anesthesia pharmacology, basic principles of anesthesia along with the pharmacology of anesthesia. Anesthetics will cover you 2 marks out of this entire 5 marks. Remaining 3 marks could be of this 3 divisions where you expect to see a lot of questions. So you may have to, apart from the anesthetics, you may have to systemic anesthesia techniques of your systemic and regional anesthesia carries 1 more mark. So this is how the anesthesia has been splitted. So you have to remember in this pattern, and it will help you score 3 out of 5 in anesthesia. So this is all about the anesthesia, people. Thank you for watching. See you with another subject.